The Master of Clinical Education program at Flinders University is founded on a cornerstone of symbiosis, a concept of clinical education based on 4 fundamental relationships: a personal-professional relationship, a clinician-patient relationship, a university health service relationship, and a government-community relationship. The student is located at the centre of these relationships. At the very heart of the clinical setting are the relationships between clinicians and patients, with the student as the key link in the chain. There is thus a triangular interrelationship between patient, learner, and teacher, in which all become both teachers and learners. It is this interrelationship that becomes the focus of learning, with the emphasis on students directing their own patient-based learning under the guidance of their clinicians and facilitators. Students bring personal principles and expectations to clinical settings. Professions are shaped by morals, ethics, and expectations, and one of the most important learning activities for students in clinical education is to match these personal principles to their professional expectations. It is an action requiring both time and support, where the student may need to make difficult decisions when reconciling personal and professional interests. Students' experiences in clinical settings are heavily influenced by the relationship between medical schools or universities and their health service providers. The key concept in a university health service relationship is that of authentic supported learning. The health service provides the context for authentic learning, whilst the university or medical school provides organisational and teaching support to the student. A symbiotic approach challenges clinical education to become embedded in the real world, to be visible, relevant, supported, and accountable to the community and its representatives. The relationship between community needs and involvement, and government policies and financial support, is fundamental to achieving a symbiotic curriculum and meeting the learning needs of students. The key to achieving a symbiotic clinical curriculum is to ensure that the relationships are reciprocal and lead to mutual benefits. All pieces work together, and while the balances may shift and change over time, it is important to understand the relevance of each area when designing and implementing clinical education programs. The Masters of Clinical Education program at Flinders University seeks to provide an understanding of this concept of symbiosis and how the various elements work together in harmony to create the ideal environment for learning and teaching within the context of clinical practice, health service delivery, and professional development. Whilst building on your own repertoire of core skills and knowledge in teaching and learning, we hope you will see the value in viewing clinical education as a complex system, a system we call symbiosis.